This is going to be tracheostomy care.
Review your facility protocols for Trach Care
So you'll take the chart, you'll open it up,
and review it for general consent
general consent.
and specific orders for Trach Care
I have specific orders for trach care,
and allergies.
and the patient has no allergies.
Gather your equipment.
So at this time, I'm going to gather
Towel, Trach Care kit, a new
Towel.
trach holder,
trach care kit, the holder,
sterile saline,
sterile saline,
correct size disposable inner cannula, a protective
Inner
gown depending on the anticipated exposure of bodily fluids,
and a protective gown, but this patient's secretions have been minimal, so I will not be using the gown at this time,
mask with face shield,
and a mask with face shield.
non-sterile gloves.
And non-sterile gloves are located in the room with the patient.
And your bivalve ventilation mask is nearby. And then you'll clean your hands.
All right, so I'm going to clean my hands.
Introduce yourself. Identify the client with 2 identifiers.
So you'll take the chart to the bedside. Knock, knock, knock. Hello, Mr. Smith. How are you today? Mr. Smith, I am Christy. I'm going to be your nurse today. I just need to check your armband so I can make sure that you are who you are. And over here, you'll look at the armband. And the armband, what you're checking for, and you'll verbalize to me, is that the patient's name and also the patient's medical records numbers.
Explain the procedure to your client.
Mr. Smith, I am in need of doing some trach care on you today. There's a little bit of drainage and stuff around, and it is time for me to do that. And so I'm going to go gather my supplies, and I will be back.
Assess their respiratory status, shortness of breath, coughing, their rate, skin color as well.
And so before you would leave to go and get your supplies to bring them back in the room, you would go ahead and take your stethoscope, and you would listen to the lungs and the respiratory rate, and you would have that to document later.
State that the client should be suctioned prior to trach care.
And so you would also make sure before you do the trach care that the patient does not need to be suctioned, and you would verbalize that during the checkoff.
Make sure privacy is provided. Position your client in semi-Fowlers and remove the pillow to slightly hyperextend their head.
So this is a private room, so the patient already has the privacy. To hyperextend the patient, what you'll do is say, "Hey, Mr. Smith, I'm going to be removing the pillow from your head to get in preparation for us to be able to do the care that we need." And that hyperextends it right there, okay? You take the pillow and you can put the pillow down at the foot of the bed of the patient.
Drape their chest with a towel.
So, the supplies that we had gathered a while ago. So you will bring the supplies into the room. And I have found that if you'll slide the table just a little bit right here, that way you can go from here to here and you will not contaminate, okay, later on when you're having to do your trach. So you're going to gather the supplies, get everything organized. Like what she said, you're going to take the towel. So Mr. Smith, I'm just going to put a towel up here, okay, and drape it across.
Then go ahead and put on a mask with eye shield, non-sterile gloves,
Okay.
and other PPE if you think there will be exposure to bodily fluids.
So right now, of course, I'm going to put the mask on. Like I said, there's gloves inside the room. That you will put on. And if, you know, I got in here and he was having lots of secretions around there, he was coughing and sputtering really a lot, you know, of course we would suction him, but I'd also probably want to put a gown on so I didn't get contaminated. And this is when you would do that.
Gently hold the trach tube with one hand as you carefully remove the soiled gauze and discard it with the other hand.
So as you know, this person does have a trach collar on. You would move this gently to the side of the patient. You'll take your hand, this is not a sterile part, and then you would take this gauze that's in here and slide it out. And that's when you're looking to see, you know, the color, the consistency, if it has an odor to it or anything. And then you take this and you dispose of it in the garbage can that you've already got set here to the side.
And remove gloves and cleanse hands.
Move the garbage can closer to you over here by your table to make it easier, okay? So then I'm going to remove the gloves. I'm going to cleanse my hands.
Then open your disposable inner cannula package, but do not remove the inner cannula.
So this is the inner cannula package that we're talking about. And you have it open.
Put on another pair of non-sterile gloves.
Okay, you can clean your hands again, because I know a lot of y'all do. You put non-sterile gloves.
When your non-sterile gloves are on, you can remove the oxygen source and detach the inner cannula. Remove and discard.
So you're going to remove the oxygen source. You're going to take your left hand. You're just going to gently touch this. The whole purpose of that is so when you're removing these little flanges and you pinch them and you pull this out, that you do not pull out the trach itself. And then you dispose of the cannula in the garbage.
Now you're going to insert your new inner cannula into the outer cannula, making sure that the inner cannula is secured.
So you will take your cannula, only touching the top part here, as you have seen. You do not want to touch this part here at all with your hands, okay? So you can turn it with your fingers, insert it just like this. You'll hold this still, and you will insert here. And then the little flanges on the side, you'll pinch them to secure it to the patient's trach.
And reapply their oxygen source.
And then you make sure that you reapply the oxygen source. That is very, very important in the trach.
Okay, we're going to remove our gloves and wash our hands. And open the Sterile Trach Care kit. Setting aside our sterile gloves.
Just remember when you're opening up the kit to pull it away from you and not to contaminate. You'll have the kit either to your far right or your far left. You'll have room to put the drape. Now the kit's going to have gloves inside of it, which you can use those gloves. But if you're not wanting to, you have to pinch the outside of it, not to touch anything inside the kit, and dispose of. At this time, you can get the drape. There's a shiny side and a flat looking side. You're going to actually pinch it up. It's going to feel slick, the feeling, okay? And you know you're pinching it up, and you're looking for a corner. See down here at the bottom, you're looking for one of the corners. Because you can only touch the outside corner. As so. Then you grab the other corner here. And you keep going. Now, as you can see, when you're looking at this, you're able to touch the outside still here. And the corner doesn't want to come to me. There it is. Now, you see the shiny side is here. I'm showing you. And the flat side, of course, is on this other side. You want to take this and put the shiny side down on the table.
Now you will dump your supplies.
You then take the supplies right here underneath.
Drape in the center.
And then you dump your supplies onto the table. Set this over to your far right or left, whichever is easier for you.
And pour your saline into your sterile basin.
Okay. You'll take the saline, not to cross over your field, and you'll pour some saline into the basin. If it spills all over the table, make sure you clean it up because it can actually contaminate the drape that you have down.
Now you will don your sterile gloves wherever you have enough room.
So, you know, you don't want to be over here on your sterile field. So I have this space here that I can actually open up the gloves. And if you don't think it's enough space, you can move to the chest of the patient as long as you do not contaminate. So you'll open up your gloves. And again, when you're opening up the gloves, make sure you do all the little bends, because if you do, then it won't flip back on you. Open it up from here. Now, you do know that you have to touch the outer part of the glove when you're going to put it on, and not the inner part. You slide your hands in, pulling down on the outer part to fit your gloves in without contaminating. And my finger has gotten bent. Okay. You then slide underneath the cuff on the other one. Trying to open it up with one finger. And just realize, you know, when you're putting on sterile gloves, the whole purpose is to make sure that you don't touch the outer part. You can always fix your fingers. This is something that's common. It happens a lot when you put the fingers in the wrong holes. Okay?
And so once you get your sterile gloves on, at that point you can kind of arrange your supplies on your tray.
Now, gloves are on, you must keep them up. So you want to arrange the supplies so you can put your brush, say, here. Your Q-tips can go here, which you'll be needing. We'll not be using the ties like this. We'll be actually using another tie. Now in here comes the split gauze, which you'll be needing. And then you'll have other gauzes here. You will use 2 for the wet to clean, and then the other one to dry off afterwards.
And go ahead, supporting the phalanges of the trach tube with a non-dominant hand. Clean around the trach site, skin, tracheostomy tube, phalanges with the applicators or the gauze soaked in saline, using a clean item for each pass.
So at this time, the patient does have an oxygen apparatus, so this hand is no longer going to be sterile. So at this time, your sterile hand is no longer going to be sterile. You're going to have to remove the oxygen apparatus. You will hold the finger on the phalanges. You will then take with your sterile hand the gauze. And so you don't contaminate, you will bring your table either closer to you this way, okay? So when you cross here, you can go around and you will do the pass once and dispose. The pass again over here and dispose. Okay, then you will take, if you wanted to, you could use, if there was a lot of nastiness on this part right here, on the white part, you could actually use the Q-tips to do that at this time. Just remember not to cross-contaminate when you're crossing over. But at this time, you'll take the gauze, you'll dap around it to make sure that you have gotten all the saline off of there, and then you will expose of it. You notice that I am not dropping my hand below my waist.
Inspect the stoma and the surrounding skin.
So what you're doing is you're looking at the skin to make sure that the stoma is, you know, pink, no drainage. But if it's having drainage, you would document that. Or if it's swollen or a lot of crustaceans and everything around it, you would document those.
And at this time, apply pre-cut, non-raveling trach dressing under the faceplate of the trach tube. And do not ever cut a 4x4 for the dressing.
So right now, you're not considered sterile anymore, okay? Because you will take this split gauze, and on the patient's chest, you will put this one side under one tie, and on the other side, you'll put it under the other tie.
And then you'll remove your gloves and clean your hands.
Make sure that you put the oxygen apparatus back on the patient. Remove my gloves. Cleanse my hands.
And put on new non-sterile gloves. tracheostomy holder, always leaving the old tie in place until the new holder is secured. Unless, of course, you have an assistant. Be careful not to ever cut the cuff tubing if trach ties are used.
So this is the holder. It will come open. You just make sure that you have the little ends sticking up on both sides. It is a Velcro. Okay, if the patient's neck's a little bit bigger, it does adjust back here so you can actually make it longer. Right? So on this side of the neck, you see the little flange that's right here. You will take this side off. Because these get really nasty, right? They have the secretions and stuff. So you want to make sure that you can get these cleaned up. And you'll thread it through. Okay. You'll take this one around the neck at the back. You can pull the other one as you're holding on to the other one. Pull it through right here. This part, you may have to slide it over just a little bit so you can see. And you see how this one is still connected here. And you remove it. You see the flange there is all good and clear. Slide it through. You'll check for the 1 finger breath underneath to make sure it's not too tight. You'll take the other trach collar and dispose of it. If this did happen with your gauze, you know, you're still not having to be sterile, and you can slide it back under there.
Go ahead and discard of all your disposable equipment appropriately. Remove your gloves and your mask and face shield. Clean your hands. Reassess their respiratory status.
And of course, you would reassess the respiratory status by listening to their lungs at all the points that you've been taught.
Make sure they are comfortable, the client.
And then you would take your pillow for Mr. Smith, making sure that he's comfortable again. Mr. Smith, I'm going to raise your head up and put your pillow back.
Now you will document in time of procedure, condition of skin around stoma, amount and color of drainage, respiratory status, and their tolerance.
Okay, then you have completed your trach care.